So fillers are all the rage right now, and I have to say the Kardashians probably have something to do with this. And now I'm getting a lot of people, young and older, who are asking me a lot of questions about dermal fillers, what they are, what they're used for, things like that. So in this video, I'm going to be sharing some of the dermal fillers that I use in the office that I like, and we'll talk a little bit about where I use them and things like that. Okay, so stay tuned. Hi everyone, my name is Dr. D. I'm an aesthetic physician in the DC metro area, and my practice focuses on aesthetics for people of color. Alright, so most of the time when people of color come into my office and they're requesting dermal fillers, sometimes they're not really sure what they want, and sometimes they really are quite aware of what they want. So we're going to talk a little bit about dermal fillers and, for example, people of African descent. So a lot of times the way people of African descent age is that they start to get what we call mid-face volume loss. And so when that happens, they tend to have more nasolabial folds, and they will also have more sunken under eye area. So in order to treat that area, we would usually need to use something quite soft in the mid-face. And for that, I like to use Restylane Contour. And this is a newer filler from Galderma, from the Restylane line. This one is more, it has what they call expression technology, which means that it's going to move with expression. So if we're putting it in the mid-face and we smile a lot, then you want something that's going to move. You don't want something that's going to be like stiff, okay? And so the other thing that a lot of people deal with is tear troughs or under eye hollows or under eye darkness, and that I can do a completely different video on, because trying to figure out if you're the right candidate for this is quite tricky. But when I decide that you're a good candidate for this, I would use the classic Restylane in this area. This one, it can be used for so many different parts of the face, but I love using it right in the tear trough area as well, because it gives you a good lift, but it's not too strong where it's gonna feel like kind of fake, you know. It molds really well. It's very multifunctional, very very good filler. So I use this a lot for my tear troughs. Okay, the next one is Restylane Lift. So Restylane Lift is has the highest G prime, and G prime basically is an indication of how well it can lift tissue. And so with Restylane Lift, I like to use it in the lateral side of the face. So a lot of times, you know, most people of African descent, for example, they have quite good bone structure, and they may not need the lateral filler in their younger age. But as they get older, they might need a little bit of lateral filler to give them a lift. So I can just do this, and you can see that there's some improvement in my nasolabial folds. So that would be the function of doing a lift, okay? So favorite fillers: Contour for mid-face, Lift for tear troughs. Nope. Sorry, classic Restylane for tear troughs, and Lift for the lateral cheeks. Okay, so those are my favorite fillers for those areas. Now, there's another class of fillers in the Restylane line called Define, and that one is also an expression type of filler. So it's one where if you place it in a certain area, it will move naturally. And so I like to use that filler in the nasolabial folds. I don't have that one right now. But another filler that I absolutely... Oh my god, I feel like crying. So that phone call was actually a patient who literally just called me to say thank you, which I don't get very often, but I don't know, it's kind of making me teary-eyed, but I love my patients. Anyways, all right, back to fillers. All right, so I was talking about nasolabial folds. So for the nasolabial folds, historically or typically, I don't go for the nasolabial folds as the first treatment. I always treat the mid-face, because like I said, if you have mid-face volume loss, then you need to give this section a lift. And if you do that, then it improves your nasolabial folds. So the way, okay, this video is all over the place, so just forgive me, okay? But the way I see you know, I don't know if you've ever heard of a liquid facelift or non-surgical facelift. So the way we approach the face, we categorize it in thirds. Okay, so let's say from the eye above is 1/3, and to give that area a lift, we're gonna use neuromodulators or neurotoxins such as botox. And then the next part of the face is from the eye to like just above the lip. And so for that, you want to use dermal fillers to give it a lift. Now, for a lot of Black people, typically they don't need temple fillers, but some people who are Caucasian, for example, might need temple filler, and so that will count for the upper third of the face. But for the mid face, you want to use the lift that I mentioned to bring up the lateral side of the face. So if I do that, you can see improvement in my face. And then you want to treat the mid-face. Now, this is the area that most people of African descent start to show their signs of aging. So they lose a lot of fat in this area. And so when that happens, you can see they start to develop heavier nasolabial folds. And so someone will come in and say, I want to get rid of this. And I'll be like, I'm sorry, but this is not the main problem. This is the main problem. Okay, so I will have them do some mid-face volume restoration, and if they have tear troughs, which I have, and mine are congenital, which means I was born this way and my kids have it. So if they want to improve that, then we can do some fillers underneath the eye. Okay, but I am starting to get some mid-face volume loss. Okay, another time when you could see this mid-face volume loss is when people lose weight. So like, let's say you've done all your, let's say you were like 200 pounds and your goal weight was 150 and you've lost 50 pounds, right? Because you cannot spot reduce fat, some of that is going to come off from your face. And one of the first places where fat is going to leave is in the mid-face area. So when someone comes and again, they're complaining about their nasolabial folds, I'm going to look at their under eye area and I'll be like, did you lose weight recently, or are you in the process of losing weight? Because if they are, then we might say, you know what, let's wait till you're done with your weight loss journey. And then we will correct the deformities that have happened because you've lost fat in that area. Okay? All right, so for tear troughs, I like to use Versa. And Versa can be used quite liberally. So Versa is used in the lips as well. For my Black patients who like to have that nice full lip, honestly, Versa is what I would go with. Some of the other fillers, like Restylane has the Kiss line. That filler is good, but I feel like it doesn't give the oomph that like our lips need, you know, like, because we have nice juicy lips and we need more volume to give that height. I don't have any lip fillers on because thankfully God bless me with beautiful lips. So that's that. Okay, so I showed you all the fillers that I love. There's some other ones that I have used fillers from the Juvederm brand in the past, but I have come to love this brand a lot more. All of these fillers that I showed you are hyaluronic acid fillers. And so what that means is that, well, hyaluronic acid is something that's naturally produced in your body. And so, and also I have the ability to dissolve it if I want to. So if there's a complication, I can dissolve these fillers. If someone doesn't like how it looks, we can dissolve this filler. Okay. So for the most part, I will use hyaluronic acid fillers for my treatments for my patients. All right. Hopefully you guys can see me. The last class of fillers that I use is this one called Radius. Now, Radius is not a hyaluronic acid filler. It's a calcium apatite filler, or apatite. And so what I love to use this filler for, again, this filler is great for Black women. Okay, just saying. But you have to find someone who has experience, because if they mess it up, they can't take it out, okay? But this filler I will typically use along the jawline. So this filler kind of acts like bone. And so as we get older, we tend to lose bone in the jawline and sometimes a little bit around the mandible. So you want to use something that is strong. So this one has the high G prime as well. You want to use it along the jawline or on the bone. So you can use this on the jawline. Remember how I mentioned the lateral cheek? You can use this as well there because you are trying to create a lift, so you can see what happens with one side of my face versus the other. So you can use this to give yourself a lateral lift if you need it. All right. This also works for mid-face, but you have to be careful with it. So again, this needs a lot of experience. But yeah, these are my favorite fillers. I haven't tried some of the other ones. I'm one of those people who, like, once I understand a particular line of fillers, I will pick what I like and I see what works for my patients, and I typically just stick with it. I don't go looking for new stuff. But I plan to try different fillers in the future. But these are the fillers that we have in the US that I really like. I believe a new brand just came out called RHA, and like the Koreans and Europeans have way different hyaluronic fillers than we do. But for the most part, this is what we have, and this is what I use in the office. So I hope that video was helpful. Let me know what questions you have about fillers. Like, I love fillers. And I'm all about, giving you natural results. So if you have questions about fillers, be it tear trough fillers or cheek fillers or nasolabial folds or chin. Oh, I didn't even mention chin, but there's some fillers here that we would use in the chin. Just let me know what questions you have, and I will definitely answer them for you. And if you're in the DC metro area, do stop by Delight Medical and Aesthetics if you're interested in any of these procedures, and we will gladly help you with that. All right, until next time, bye.